Hi, I'm Bridget Bartley with the Woodrow Wilson Rehabilitation Center. Today I have joining me Dr. John Benesek. He's the director of the PTSD program with the McGuire VA Medical Center. Welcome, sir.
Thank you.
Thank you. What is PTSD exactly?
The formal name is post-traumatic stress disorder. But basically what it is, anytime somebody goes through something life-threatening or traumatic, it leaves telltale symptoms. For instance, being in a war zone, combat area, everything may seem like it's fine, but then when you come home, you start having recollections of what you went through, what you experienced, different sounds, smells, sights. And a lot of times, guys and ladies start having dreams, start having triggers that might set it off, so that's PTSD.
And the different symptoms consist of?
Sure, it's a whole slew of symptoms, but usually we get emotional numbness, in other words, not feeling a whole lot of emotion. Getting irritable, even the smallest things, not sleeping a whole lot, maybe 2 or 3 hours at a time, but even then, kind of sleeping with one eye open. In other words, a lot of my vets who have PTSD tell me they can hear the slightest noise and they're up, ready to go. They're checking the perimeter, they're locking the doors and all that type of things. Depression, memory problems, concentration problems, short-term memory especially. And of course we have what we call social withdrawal, where you don't want to do a whole lot, be around a whole lot of people anymore.
And what are the different treatment options that you provide? Sure.
At the VA, we have, of course, medications, which is often not a first-line treatment, but we use that to help with sleep, help with the irritability. But the primary things we use are group therapy and individual therapy. Individual therapy, the key is what we call exposure therapy. A symptom of PTSD is if there's something that gets stirred up, a memory that gets triggered, the first thing to do is to bury it, not think about it. But you don't heal that way. So what we do is we work with the veterans to talk about what those memories are so that when they do think about it, it's not as intense. Mm-hmm. And a key component of that as well is group therapy, because now we have a unit again. The men and women are together. They have a sense of camaraderie. Everybody else in the room knows what they're going through or can appreciate it. And they've been there. So it makes a lot more sense. Exactly. Credibility.
Respect it. Yes, absolutely. What is your hope for our future returning troops and their families and their loved ones?
I think the number one thing is education about what PTSD is. That's primarily what we do there. You have to understand what we're talking about before you can do anything about it. The other thing is what we call normalization. In other words, the way I define PTSD is a normal reaction to an abnormal event. Most of us aren't going to go through what these men and women do on a daily basis and what they see. They have a normal reaction, which is fear, loss of control, loss of power, having these different re-experiencing events. But if you're educated about that and you understand that's part of the process, then it makes a lot more sense.
Right.
Veterans are less reluctant to come in. It's also important to tie in the family members. They're affected as well. When their son and their daughter, husband and wife, doesn't want to interact anymore, when it seems like nothing's really going right, well, now they have an answer for that and how they can address it.
Right, right. Good luck on your program, and to all of our returning veterans, their families. Good luck.
Good. Well, thank you.
Thank you for joining us today at the Virginia Wounded Warrior Summit.